Hello guys, welcome to the next episode of Let's Play Hospital, where we are continuing our long challenge. It's 60 people that we have to uh, diagnose and treat with a lot of restrictions of what we can see. Actually, it's not that much of a restriction, but still. The only problem is that we can only select 6 doctors. And apparently so far these 6 doctors haven't got too much of business, so it takes a little while. I'm pretty much sure that since we are at the same time progressing with the day and we are making money and everything, I'm pretty sure that we probably end up doing some more than just that. We already have $10,000. Let's see where we have some people who are waiting for me. Nancy Cole is waiting for me. Who else? Nobody here, nobody here, nobody is in ICU, luckily. Oh, we have a lot of people in General Hospital, so maybe, I mean only 5, this one is, Frank Anderson is in the bed until probably tomorrow morning. Let's see, treated, going to chair, going to chair, going to chair, nobody here, nobody here, and nobody here. So basically, only Nancy Cole is waiting for us, that's good. We do have 42 people in the hospital, 38 outside, and 4 in beds. And I think we're doing all right. Let's just see. Nancy Cole, we already know that she has a copperhead snake bite, which means that she definitely has to go to the traumatology. There you go, please go there. And let's see what we need to do. We do need a physical to see if he needs some NSAIDs or whatnot. We should check her vision and blood pressure. That's it. Now let's take a look at, I think we said that there were nobody in, well, there were actually 5 people there, that's a lot. But 2 of them are already treated. One is idle, I don't know why. So that's not so bad. I think we're gonna send her over anyway. So you go over there, you got a physical, and let's do a blood pressure and a vision. I have to look for it carefully because it used to be one or two pages. Now I have like 8 pages that I have to look through. And apparently I missed it. Go back again. The good thing is that I know that it's definitely there because everything is there. Unless if it's something that I cannot do over there. Maybe I cannot actually check. Basic visual test I cannot do. That's fine. I don't think it's a big problem. It's just a low stuff, so that's fine. Let's continue. Hold on. Actually, it's in this mode, but doesn't matter. Let's continue the day. So we are basically using the doctors mode DLC, which means that we are controlling these 6 doctors, and we are in specialist mode, which means no hints in diagnostics, high number of hidden symptoms, and disable pausing hidden symptoms. Now that's actually weird because it's the same with everybody, you know? So actually, okay, it's all patients are your own patients. Then just let's pay all patients and it's clear, okay? Because actually that has been like that anyway for my and not my patients as well. So I don't think there is a difference. So let's just make sure that it's for all patients. And let's go to Maria Garcia here. Where are you? You're sitting already in the doctor's office. Good. You have bacterial tonsillitis. We know that for sure. We already checked your oral cavity. We checked. We didn't do that. We didn't do a laryngoscopy, but I'm not going to do it. Let's just treat you right now. Elizabeth Hernandez is me. I mean, I'm controlling her, so I'm actually giving her everything personally. I'm not sure if it's necessary, but I don't want to screw things up. So we're going to give him the fever medicine. No need for that. No need for that. No. We're going to have him analgesics, which is pain medicine. Pain in the ears, still the analgesics, that's fine. We're going to give him some, we're going to give her some NSAIDs. And no need for that, so you're set. Thank you so much. I'm gonna still keep it here. They're gonna tell me that hey, it's finished, and then I'm gonna send her home, and then done. We have 2 people so far, only out of 60, so it's gonna take a while. Okay, so as you can see, this is what happens. So this person already taken care of everything. So because this is Patricia Smith is actually it's not even my doctor. Not even me, but that's okay. She can just go home. Alright. And she's giving us $780. That's nice. Unfortunately, it wasn't our doctor, our patient. Let's go to here. Shaft fracture or simple fracture? Huh. Let's see. Do you have anything very serious? No, Dana Harris is actually good. We are doing, but however, these both are orthopedia related things, which is not good. Fracture surgery. Oh. Okay, hopefully he just needs some arm orthosis, but how can we do it? Everything is the same. So we're gonna have to have a physical. I don't think so. I think it has to go through some... I think we have to have some... Yeah, a CT is probably gonna determine it. So let's do SCT, and hopefully it's gonna simple fracture, because if it's gonna be a shaft fracture, we have to send this person away. I don't think it's gonna happen, but let's send for a CT. Now, how many people are in here? Let me just take a look. Without these people, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3. Oh, only 15. You know what? That's not a bad number. That's only less than 2 per doctor. So, since I don't have anybody, I believe, in orthopedia, I'm gonna actually treat him myself. Let's go for a CT. I think it's in the bottom. There you go. Do a CT and come back, sir. Judy Robinson. Okay, you have a lot of different things. Jennifer Foster, again, is not my doctor. I mean, he's not my patient. Okay, actually, oh, wait a minute. He's the one who is hospitalized. He already got the urine analysis sampling, but he still need to test it and do microbial cultivation. So we're just gonna say, okay. Just wait for him to finish that. Paul Jackson. You are just coming freshly out of there. Okay, so let's do a physical. Do we need to check the temperature? Is there anything that would be high temperature? No. Let's do a chest auscultation. He might have some breathing problems and stuff. Let's do a neck palpation. Let's also do an oral cavity. Okay, because right now I'm hoping that, I mean, it doesn't really matter that much. James Gonzalez is not even my doctor. I kind of hope that, you know, it's one of these, because then I don't have to do a lot of other tests. But let's just do this. Oh, he has hematuria, which is... What is hematuria? Oh, okay, it's blood in the pee. That's not a good thing. But at least we know exactly what your problem is. We didn't do a physical right away. Oh, because it only gives him some rest and we already give it to him? No. We should definitely do a physical. Why didn't we do a physical? No need for that. Okay, let's just do a physical and then we're gonna treat you, no worries. Rachel Harris, headache, nasal congestion. Let's just do a physical. Let's do a temperature. You said nasal congestion, so let's do a nasal cavity, but also a chest auscultation, okay? Should I do also, let's do an oral cavity as well. No, let's just keep it simple. Patricia Gonzalez, the one that we just saw here in the down portion. So you got a dizziness and headache. Let's do a physical. Let's do a speech listening. And let's do a temperature. And I think I'm gonna do a blood pressure. Okay. Nancy Hall. We did a physical and it turns out that you do have this problem. Thrombophlebitis. Thrombophlebitis, yeah. Looks like it. What do we have? We don't need an angiography because that would be just showing this one. USG would be the same. Physical, which we already did physical, so I believe we're just gonna treat you. Daniel Jones is R1, so let's actually do it ourselves. Thrombolytics, we're gonna give him, her, sorry, no need for that. He needs some pain medicine. He does need some bronchodilators. And also, okay, he needs the analgesics and he doesn't need that one. So I think we're fine. Just treat him, please, and let him go. Let her go, sorry. Okay, so Elizabeth White just treated this person. As we just said, everything is okay, so just go home. We got 270 and 3 out of 60. That's a lot, so we might actually do like, let's say 20, and we jump back to like normal treatment. Otherwise, it's gonna take a million years and could be boring for some people. I don't know. For me, it's not, but again, let me know in the comments if you are enjoying this part of the stream. Okay, there you go. Elizabeth Hernandez, Mary Garcia, the same thing. Look at that. Everything is treated. Let her go and done. And we have 4. There you go. And she's drinking some water. That's fine. Carol Johnson, you are waiting for me. You have actually dizziness. Why did you go to a traumatology? That's kind of weird because dizziness can have 8 pages, 8 times 6, 48 possible diagnoses. Yeah, only 46, but still a lot. Okay. Anyway, let's do a physical, a speech listening. Let's do a temperature temperature test. Okay. What do you want? Chest pain. Okay, that can be again a million things, but look at that. We've done a million things and nothing came up. So this guy might be a prime subject to go to observation, but for now, let's give him some analgesics so he's happier, he feels better. Okay. But what should we do with him? We did a CRP. Did we do a CRP? Yeah, we did a CRP. So what can we do with him? Holy. We're already running out of like simple stuff that we can do. Okay, let's see. Chestos basic, neck palpation. Neck palpation, would it give us anything? I'm not sure. You know, I cannot even see that if there is something here it's gonna help us because some of them won't. Okay. I don't know, it really seems that if you do an ECG, it would definitely determine that he has to go to cardiology. So let's do an ECG first. If we haven't done it yet, because we've done so much. ECG, where are you? ECG, there you go. Do an ECG first, and then we'll take it from there. Okay. Let's not jump the gun too quickly. He has ocular hypertension, which means high pressure inside the eyes. We found out with tonometry. That's right. But we still don't know what your problem is. That's crazy. Come on. I think we need to do the microbial. Because everything else we did, physical, interview, of course, physical, ophthalmoscopy, perimetry we did, right? Perimetry, yeah, we did. And we didn't do an MRI. Microbial is one thing that we can do. We did the neurological testing. We did, right? I think so. Yes. So literally the only two things that we can do here apparently is microbial cultivation and an MRI. I'm just going through literally everything, so make sure. You know what? Let's do an MRI first. Because microbiome takes a bit longer. So let's do that first. You should be here. Okay. It could be orthopedia, it could be even neurology, so we don't know. Let's do a physical. Let's do a temperature test because it's possible that you have fever. Finger numbness. I would do a neurological testing actually. And I'm thinking, should I do like the oxygen whatever thing? Physical, CSF, I don't really want to do it. Serologic, physical, chest, blood pressure. Okay, actually, you know what? Finger numbness could be done. Could be something about blood pressure as well, but let's not go that far for now. I don't want to do too many things unless I know where this person is going. So physical, temperature, and neurological, I think is going to be just fine. Giant cell arteritis. Oh, I'm sorry to hear that, sir, but at least we know what your problem is. It is in cardiology, so we are in the right place. And this is actually my patient, which is good. Let's see, physical we of course did. We did the ophthalmoscopy, I believe. Or we couldn't do ophthalmoscopy here, either way. Yeah, we cannot do ophthalmoscopy, and we did a CRP testing. Please tell me you did. Because that would give him NSAIDs if he haven't. So let's do a CRP before we do anything more. Because otherwise we cannot give him NSAIDs. So, okay. Carol Davis, yes, you definitely have thrombophlebitis. We haven't even started anything. That's really impressive. I think we have to do a physical. Could give him ice rep. I'm not sure. Yeah, let's do a physical. Let's see if you need an ice rep or not. But other than that, actually, we have nothing really. Thorax percussion would only give him analgesics, which he already get, the pain medicine. And these are giving him what he needs. So physical is actually not even necessary. I could treat her right away, but let's just be extra careful here. And by the way, we already have 24 people fully treated out of 77. That's good. But what's the time? 12:27 in the afternoon. We have to keep an eye on the time. Let's see how many people are actually treated already or being treated. Let's see. We have 1, Only one here. None here. None here. None here. 2. None of them here. Okay, we only actually have 2 people being treated. That's not a great number. That means we have basically 26 people done out of 77, and we started at 8. We are getting very close to the half, so it can be tight. Let's see. Kate Barkley. So what is your problem? Barkley or Berkeley, or how to say it? Fever and malaise, which is a general feeling of discomfort, unease, and sometimes pain, which means nothing. You could have a lot of different problems. So let's do a physical. Let's actually check your temperature because it could be like extra high in some cases. Let's do some chest auscultation. Let's do some speech listening. I'm not even sure if it's necessary. Do we have something that would end up with a speech listening issue? Could possibly be, but I don't. Maybe not. Then let's just do a neck palpation. Okay? Just some very simple things that you can do very quickly. So that's going to take a lot of time. Okay, you have a clavicle, simple fracture of clavicle, which, by the way, I knew because, again, this is the problem with this game. I don't have an orthopedia hospitalization and I don't have orthopedia surgery, which means it's definitely the one that doesn't need that. Okay, now everything else is done, so I'm just gonna actually supposedly it should be done in orthopedia, but actually in orthopedia we have a ton of people right now. Look at that. Oh no, only 2. How many we have now here? Still not a lot, so I'm just gonna treat him like this, okay? Doesn't matter, I'm gonna treat him here. So we need a arm orthosis. That's basically the actual treatment. I don't know if I need an emergency care. I'm gonna put it there, but probably they're not gonna do it, because if you get an arm orthosis, I don't think that you would have a separate emergency care. Probably I should have done it before while I'm checking on him, but if I do that, then again, like, how can I do the examinations later? So I'm not sure how it works. Analgesics, if you guys know that, please leave a message down below. How it works actually, because I see many times when the doctor does it, he also or she um, skips through emergency care. They don't do it, or I've seen it before that it was just not done. Like I left it there and it was just left there without actually being done. So I'm not sure. Sagging shoulder, pain, we give him already the pain medicine, dizziness. Yeah, nothing really we can do. I think we're done. So let's just treat this person. Oh, look at that. Somebody is going. John Scott is finally being taken to the ECG. It took a while. But look at that. We still have no idea what his problem is. That's why he's in observation, obviously. That makes sense. Nancy Hall, what happened to you? Oh yeah, you are already fully treated. That's great. Everything is good. It was low anyway, so redness and this are low. So we don't need the anti-inflammatory cream, I believe. So let's just let him go, and I believe this is my doctor. So let's see if it goes up. Yes, we got one more. Fine. Frank Allen. I remember the name. The problem is I think they are recycling some of the names all the time. So just because I remember somebody's name, it doesn't mean that I actually remember somebody there. So let's not forget that. We already know what your problem is. Mark Johnson is, I believe, not our doctor. No, it's not, but still, we have to treat him. And he's in the eye department in orthopedia. Let's see, physical, we've done already. CRP would give him NSAIDs, but we already getting the NSAIDs. Blood test would give him nothing, and he's gonna get the corticosteroids anyway, so just treat him, please. Let me check if he needs he needs the diet modification. Sometimes I have to have them. Recommendations I have to give. If anything medium, I'm gonna give them. And the NSAIDs, there you go. So he ended up having everything. Kidney stones or urinary tract infection. Okay, he has urgent urinary chills and hematuria. Okay. Where did physical? Abdominal palpation didn't show anything. Temperature didn't show anything. Really, it comes down, do we do a CT or a microbial cultivation? Now, CT is much quicker. And by the way, if we have that, that's actually better because it gives us more money. But let's do a CT. Now, if the CT doesn't find anything, will it automatically tell us that this is what he has? I guess so. So let's just send her to a CT. And we're good. Now, as you can see, our CT, this is our current radiology department. Okay, we have a X-ray, we have I think this is the MRI, this is the CT, this is, I think it's sonography, and this is cardiography, and this one is a CAG, which I almost never use. Now I have all these people. Oh, he actually right now he has somebody. Oh, he's got doing the angiography. Okay. So let's see. Everybody has some people to be treating, but not a lot, to be honest. Like this one is just bored. She's just bored. It is what is this place? USG, yeah. I haven't done a USG for a long time. This person seems to be very bored too. Although city, I just sent over somebody, so she's gonna be fine. And geography, and who is this person? Oh, somebody here is missing actually from the MRI. Probably I don't know, probably went to the toilet or something. I don't care. We can check it out. Let's see, where are you, my friend? Don't skip working. He is filling needs, yeah. Where are you? Oh, he's eating. Okay. You are, of course, allowed to eat, sir. No worries. Okay, so let's go to Paul Jackson. He has bacterial tonsillitis. He has a ton of different things. Oral cavity and neck palpation. We already did that. Let's do a neck palpation. What would it give? Just analgesics. You know what? You don't need that, and you don't need that. Nasal congestion would give you nasal drops, what you right now don't have. So let's do that. If basically a test would just give us the same result as everything else, I normally don't do it. However, it's like in a twofold things. If you haven't diagnosed anybody, then we do things that maybe cannot even be treated, or just the same treatment as everything. Where is the nasal? Where is the nasal Am I missing something? Here you go, nasal cavity. Sorry, I missed it. Okay, we're not gonna give you what is it? And laryngoscopy, because you're already getting the antibiotics. So why would you? All right, let's do a nasal cavity here. So if we still have a lot of different possible sicknesses, then we actually have to do things that possibly cannot even be treated, or it's very unimportant, but it could actually identify the sickness. Once we identify the sickness, I have to go through and everything that could be at least minimum, medium, it could cause troubles. I have to check them and treat them. So that's how it works. I believe we already did everything. Carol David, we did a physical. I don't know if it came up with anything, but let's see, nothing else is left, right? This is physical, and no, this is thorax, but it would just give you the pain medicine, what you already have. So I believe I am just, in case Aaron is not control doctor, so let's just treat you. Okay, again, you see, it doesn't give him, for example, the broncholitis, which is very mean. She needs it. Okay. Anti-inflammatory. Okay, you don't give him anti-inflammatory because it's just a low little swelling. I am okay with that, but you have to give him the broncholitis. He doesn't have any air. Come on. Go to this one. Beef tapeworm. Okay, that's nasty. Lisa Hall, are you my doctor? No. Gosh, I might have picked up the wrong doctors because they don't have a lot of patients. I don't know why. So, but I'm not gonna like. I could actually like start sending people over to those doctors, but I don't. That's not how the hospital works. And by the way, that would really clog up the system as far as I'm concerned. So we're not gonna do that. We can do an abdominal, but it would only give him pain medicine. Interview, we would know if he had a loss of appetite. He doesn't, so I think we're just gonna simply treat you. And again, let's double check. Headache, low, weight loss, low, and dizziness. Everything is low, so you don't need any of that. Go ahead. Go to calculus of ureter. Okay, kidney stones, also known as ureal urolithiasis, and are usually concretions of calcium. Even though the stones usually pass on their own through the urinary tract, they can sometimes get stuck in the ureter, which is an extremely painful condition. I believe so. I don't want to have that. That's for sure. At least we know that that's what you have. William Young is not our doctor. I know that, but that's all right. We already obviously did the physical. We didn't do this. Oh, we did the urine analysis as well, so we really did everything. We don't need to do a USG. That's why my USG people are so bored, because I don't need it. I can just simply treat you without that. And let's see, abdominal pain, because we have the same time, at the same minute, we have another customer, or patient, sorry. So I have to double check. I'm just gonna make sure that I give him whatever he needs here. I'm gonna give him the antibiotics. I'm gonna give him the pain medicine. I don't. We already gave him the pain medicine. Let's give him rehydration. Means just tell him to drink, really. Okay, so antibiotics, rehydration, pain medicine. I think that's all. We don't need the recommendation. Okay, and the rest the doctor is going to give him. But first, let's take a look at. Oh, look at that. Everything is done. He's not our doctor, but everything is checked, so all we have to do is let him do it. With actually, again, remembering he's itching, but not that much. Edema is not so strong, so I think we're good. We only give him everything that is at least medium. That's good. Thomas Wright. This is the patient that I almost put into the observation. I might actually put him still there. Look at that. It's 12:40 in the afternoon. He is done the microbial sampling, but he hasn't actually done the cultivation, and the urine analysis is still going on as well. So this guy has been waiting forever. We only know that he has fever, and it has 23 pages of 6 each, which means that 138 different possibilities what he has, and that's crazy. And we have done 4 full pages of different testings, and it's driving me nuts. Now, of course, these two, we have to come back with some results. So let's do a skin allergy test, maybe. Okay. Sometimes it's weird, but it could help. What else could a fever show? Let's take a look. We even do we did a PCR testing already, right? Yeah, we did a PCR sampling. So even that one is done. Okay, so what's the difference between mycologic and microbial? Microbial sampling is the collection of samples from the patient body for further analysis. Microbiology lab. Collecting various samples from the patient's body for cultivation in order to determine which fungal species are present. I don't think that he needs that. Okay, so that's only when food, there is food fungus or whatever, and apparently I didn't even realize that that was a whole different thing. Serologic sampling could be something that we should add to it. And let's do a full blood. Come on. All right, let's go nuclear on this guy because he is really showing like not four full pages, 3.5 pages of stuff, and he still doesn't show anything. So let's actually do that. Okay, Nancy Cole, you're back. Copperhead baked snake bite, we know that already. You did everything. We cannot do a basic visual test, but that doesn't really matter. So let's just treat you. Jane Green is gonna take care of you. There you go. Again, let's see if you need a rest, maybe. Weakness with rest, it's low. I'm always double checking on this to make sure. Yeah, these are all low things, so that's fine. Carol Johnson. Sunburn. Okay. Yeah, you look a little bit darker than others. Yep. So, 67 years old. You look good for 67, though. Look at that. Okay, if she's 67, I mean, why does she have a sunburn when she's 67? Did she go at some sunbathing? That's nice. Physical, microbial. No, it's physical also. So really, we already know that that's your problem, and that's what the evaluation would show. So Barbara Williams, you just have to fix. You just have to help her. Okay, so now we actually had a little hype train. We had a few people, who we have treating. So we're gonna have some people like finished soon, but we don't actually see them because these ones I'm always just relinquishing the control. So I don't even see when they are finished. Let's see. Do we need tranquilizer? No, it's low. It looks everything is low, but let's just double check. Yeah, we're good. Okay, common cold laryngitis or respiratory syncytial virus. That sounds scary. Okay, we did physical, temperature, nasal, and chest. I think we should need some oral as well. Neck palpation and oral cavity. Yeah, let's do that. Let's see. This is, again, it's pretty much sure that she's gonna stay here, but that's okay. So oral cavity and neck palpation, right? Neck palpation, and where is the oral cavity? Here. Anything else? I think let's just do that first. Thomas Jackson. Okay, we know exactly what's your problem. Karen Hernandez is not your doctor, so not my doctor. So let's just treat you again. Oh, he should need some oxygenotherapy, but because he's a little bit bluish, but we cannot do that. So sorry about that. Hopefully it's gonna be all right because it's a medium one. So problem is, I believe even here you cannot do it because you need to do it. Actually, yeah. You know, it doesn't give you regular hospitalization. It could put you into TC hospitalization, and then I could do probably the cyanosis. But I'm gonna actually keep this guy around. Hold on. Thomas Jackson, let's remember him. Okay, I'm gonna get rid of all these people now. And let's take a look a minute later if he is actually, Thomas Jackson is done. Angle closure glaucoma, that doesn't sound good. Acute angle closure glaucoma is caused by sudden and rapid increase of the intraocular pressure. Okay, so maybe he was like suddenly having a spinning around in a car or something. I don't know. I mean, I'm just have no idea. He's got a lot of different tests. At least we know that what he has. So now we can check what else we can do. We cannot do interview. Didn't show anything, right? Nothing. Basic visual test we did. Nothing showed. Tonometry, I believe we've done. Yes. Neurological testing we did. Nothing showed up. And physical we did. So everything is done what we could do. So Patricia, please just take care of him. Now again, let's see to make sure that he gets everything. None. Eyes. Oh, eye surgery. Okay. You need an eye surgery. Okay. That's not gonna happen. Wait a minute. So here's the thing. We probably have to do an eye surgery here, but in order to do an eye surgery, and that's weird, that is the neurology department that comes up with it first. This is the neurology department. Let's go to the planning. We already have doctors and shit. We do have, the good thing is, if you go to neurology, actually we do have surgeons. And we do have surgeon and nurses and everything. So basically, we are set for it. The problem is a surgery operating room, in other words, would be 25,300. That's a lot of money. It wouldn't cost us any extra doctors. So technically speaking, should we set it up? Like we have the surgery nurses, we have everything for it, right? It needs one doctor, two doctors, one anesthesiologist. So basically, all the doctors would be busy with her, and one surgeon nurse and one normal nurse. And we have all of that, and there is nobody really here. Problem is, we're not gonna make enough money, so we are already a little bit down in the rabbit hole, but we still have, well, 95% right now. Why is 95%? What's happening in the internal medicine? Hold on. Internal medicine, why are you unhappy? Oh, we have some bored patients and depressed staff. I don't like depressed staff, but for now I'm gonna deal with them. When I get into more like a management status of the game, I will try to deal with those people because I don't want anybody depressed working for me because they totally um, they totally pull down your prestige and everything. Both the staff and patient satisfaction is low. Why? He's just only one person bored. Like, come on, who is bored? Let's see. If I want to do that, I probably need to get another 40,000 to be on the safe side because 25,000, I have 13,000, 15,000 right now. By the end of the day, I'm probably going to have more than the 22,000, but I already have some, probably I need even more than 22 because we also have to pay so 27 or something. Um, we might have some more tomorrow. Okay, you know what? Just to be on the safe side, let's get 40,000, which is getting our job a bit more difficult. Now we have a ton of money, so we are going to actually get a neurology surgery, and we're going to have the first operating room in this hospital built in. And it should be this way, yes. So we're going to have an operating room. We don't even have a bathroom. We don't have anything. So I don't think people are going to be happy. What are you talking about? Yeah, here. Wait, neurology. Oh, okay. I wasn't clicking on neurology originally. I'm sorry. I was clicking on the wrong thing down here. So operating room now, it's working. Good. Okay, and we have congratulations. However, it's not good enough. It's ugly, so we're gonna go actually do a little extra here, which at the end of the day is gonna be useless because we're gonna have another one here, but that's fine. Let's do this like this. Here, here. Come on. Here and here. Now, people might be upset because we don't have visiting room and anything like that. So maybe they're gonna be a little bit upset about it, but come on. We right now, okay, so we're gonna go back. We're gonna have the control. Keep the control here. Okay. And we're gonna let's see, we're gonna give you some analgesics. Okay. We don't need anything for this. This one would need eye surgery, and actually this one needs an eye surgery. So the actual treatment is an eye surgery. And it needs HDU hospitalization. So let's go for HDU hospitalization and eye surgery. And we keep it on, so hopefully we're gonna see when and what happens. I'm not sure, so I think we should keep an eye on here. Okay, Daniel Hernandez, I think we took care of you. Now, that means that from now, I'm gonna keep watching here, which is my HDU unit. Hold on. Is this the HDU unit? Yes, this is the HDU unit that I have, so I'm gonna keep it here. Or you know what? Let's try to go. No, it's not Thomas Jackson. Paul Jackson, right? No. Who is that poor guy who we just got into there? Are you serious? Hold on. Neurology department, who are you? This one, Daniel Hernandez. Yeah, why are you hiding? You don't want the eye surgery, yeah? You're afraid of the eye surgery. I'm sorry. Okay, so where are you? We're gonna actually follow you around if you don't mind. And in the meantime, Paul Jackson. Bacterial tonsillitis, we have nasal, oral cavity, oral, neck palpation. We don't need that, to be honest. Ear exam, we don't need that. Nasal, we have. There you go. You just treat him. Okay, and... Okay, hey. Daniel Hernandez, I want to see where you're going, so we might actually slow it down. Otherwise, we're not going to see it. Okay, Mark Martinez. He has a chest injury and breathing problems. That's nasty. So let's actually give him these two things, and then let's do a physical. Can you do a differential? No. That's all right. Let's just do that. Okay, and Kate Barkley. Oh, you got the shingles. Okay, Elizabeth White is actually our doctor here. That's good. You just gonna get an antivirals. Yes. Fever medicine. This is the antiviral again. No. That's all you're gonna get. I'm not gonna give you any of the rest. Sorry. So you just go and let's go. He's going to chair. Why are you going to the chair? What are you gonna do? Oh, he still has a tonometry going. Why? Okay, so I think he's still gonna do a tonometry first and then he goes up to the hospital. That's possible. That would make some sense. Okay, if that's the case. Okay, so this one, Thomas Martinez, we have everything about you. Patricia Smith, you just simply treat him like that. Let's see, where is he going? Going to bed. All right. Mary Hill, you have a migraine. Okay, that sucks. How many people are in neurology? Look at that. The neurology department is kind of busy right now. Thomas Martinez, Daniel Hernandez is going up, so we have 3 people down here in the clinic. You know what? That's okay. I think it's all right. Migraine, he just needs actually headache medicine, so I think we can treat him right here. Let's see how many people here. Because my concern is not about, still a lot. My concern is actually not about the treatment itself. My concern is about, we still need to figure out a ton of different things about you, probably. We have some hidden symptoms still. So why don't you still go over to the neurology? Let's see, do we have anybody in neurology? I think we had Nancy Cole. Yeah, go to Nancy Cole, please. She's gonna be waiting for you. Thank you. Okay, you go over and let's do some physical, maybe? Just some physical and neurological testing. Some very basics. Neurological, what would it give? Recommendations. Yeah, it's medium, but already have the recommendation. Hold on. abdominal palpation is probably more important because he might have some constipation. Okay, that's much worse. So you go there, you're going to be treated. Let's see Daniel Hernandez. Patricia Lee, Meniere's disease, and Jennifer Harris is not our doctor. You're falling and vomiting. Ugh. Okay, you gotta have some physical, I believe. Let's do some physical. Actually, I think we should do an ear exam. Yeah, look at that. Actually, it does. Ear exam and odometry as well. Let's just do an ear exam. Odometry, how serious is that? Not really. How many people in that department? I think there are not many people, so we should be all right? Yeah, 3 people, 1 is already being treated. So, yeah, let's just make sure that you get everything that you need. So let's do an odometry as well. Physical, speech listening. Let's do that. I mean, we already know what your problem is, so we just have to figure out what else we need to be aware of. All right, and that's basically where we are. We're gonna stop right here. This guy here is going to hospitalize. I'm not sure if they're gonna do the tonometry first, or I mean, they're gonna put him into the HDO hospitalization. I don't know if they're gonna do a tonometry first, or is it even that important? Yeah, I think it's important. Or they're gonna do first an eye surgery and then maybe do that as well. Or maybe it's not even necessary at that moment. I don't know. Anyway, we have to finish it here, guys. I gotta go to work. Thank you very much for coming if you're here. If you like what you see, please hit the like button. Please hit the subscribe button. I think we actually managed to open, getting ready for surgery for, I believe, the next episode. We're gonna have an eye surgery, and I'm gonna try to catch that and watch it, what's really gonna happen. So we are basically getting really into our hospitalization. This day, we only have 5 people treated with the control doctor, so I'm probably gonna jump in and out of this one because it is very slow. I enjoy the process, but maybe once I did 10, maybe I'm jumping out of it and just keep normally. We still have some money here, but we are deep in debt right now. So at the end of the day, if it's possible, I'm going to start giving back some money so that we have less daily interest that we have to pay. Other than that, I think we're good. Don't forget to come back again next time. And I see you guys later.